Good afternoon, everyone. Thanks for joining us for this COVID-19 press briefing. Today, Orange County Mayor Jerry L. Demings will discuss the progress of vaccinations here in Orange County, including information on registering for appointments, necessary qualifications, FEMA sites, details on Advent Health vaccination appointments, and much more. The mayor will also have a big announcement on mental health and support offered by Orange County government during these and other tough times. He will also report on where we are going and information regarding our COVID infection numbers, the work of our strike teams, and other details. Epidemiologist Alvina K from the Florida Department of Health in Orange County is also here to discuss important details regarding infection rates and state vaccinations. We'll start with the mayor. Mayor?
All right. Good afternoon. Welcome to our 118th press briefing since we began under a state of emergency a little over a year ago. This afternoon, I'm going to talk about a number of things. We're going to give you a great update, but we do have individuals who will be available for questions based upon some of the information that we will share. We have our compliance team manager, Tim Bodick, who is here. In addition, we have Ms. Donna Weiss. I'm going to be talking about a mental health program that we'll be engaging in here within the community. And we have Battalion Chief Eason, who is here regarding the initiative we talked about at the last press briefing, where we'll be canvassing in neighborhoods and doing inoculations for homebound individuals. And so with that, let me just start by sharing the announcement about a new mental health initiative that can be found online and is completely confidential. Of course, this has been a difficult year for all Americans, and certainly those here within our community. That has resulted in various depression and other things for our residents. The new program is called Orange Connects, and it is web-based and will be a platform that was developed by mental health experts in Orange County's Community and Family Services Department. Ms. Donna Weiss, again, is here, who will be speaking to any questions should there be any. The idea of Orange Connects is to connect our residents' emotional needs and with behavioral health providers and services right where they live and work. Grieving for a loved one, isolation, loss of income, and fear are triggering mental health conditions or exacerbating existing ones. Many of our residents may be facing increased levels of alcohol and drug use, insomnia, and anxiety. But please know that you are not alone. Perhaps many of you in this room, since we've been living through a pandemic, have experienced some insomnia, some anxiety, and other things in your daily lives. If you or someone you know is struggling, there are many types of support, treatments, and other options available to you through Orange Connects. We want you to know that it is important to seek help during these difficult times. You can go to our website at ocfl.net/orangeconnects or the www.orangeconnects.com for more information. And now let me just kind of transition to talk about where we are with vaccinations within Orange County. The Orange County Convention Center vaccination site remains a busy place, but we are not seeing the capacity that we'd like to see there. Up to 3,000 a day can get their shots at the Convention Center. We are experiencing depressed demand for being vaccinated, given the current eligibility criteria for 60-plus year-old individuals. As we now have approximately 57% of those 60 and older having received at least one dose of vaccine. Consequently, I'm announcing today that we have notified the state that beginning on Monday, March the 22nd, we will lower the age to allow anyone 40 years old or older to go to the Orange County Convention Center and be vaccinated. Remember, the Convention Center site is open from 6 days a week, rain or shine. I know the FEMA-run site at Valencia College West is open 7 days a week, but if you prefer to stay in your car, the Convention Center is the site for you. You can get information again about what we're doing with vaccinations by going to our website at ocfl.net/vaccine to find a link to make an appointment. As I mentioned, the FEMA vaccination site is open 7 days a week at Valencia College's West Campus. No appointment is needed there. It is walk up or drive up only. As for the FEMA satellite sites, the Northwest Neighborhood Center on W.D. Judge Drive is the latest temporary site. It will be open today through Saturday. Then from Sunday through Thursday, the South Orange Youth Complex will be the satellite site for anyone who qualifies for the vaccine. Again, all of these sites are walk-up only. There are still appointments available for tomorrow at the Advent Health, a pop-up site outside the Orlando International Airport. Appointments are required at that site. To register, we ask again that you go to the website at ocfl.net/vaccine. There are encouraging numbers that we're seeing within our community. Our 14-day positivity rate is now 5.2%. I know Ms. Hsu will get more into the numbers and the data in just a moment, but 67% of all residents 65 years of age and older have received at least one dose of the vaccine. We are making remarkable progress. 15% of all Orange County residents have now received at least one shot. But that doesn't mean the coronavirus is not a threat. There have been a reported 119,224 COVID-19 cases reported in Orange County. 1,158 residents have died of the coronavirus. Those numbers edge up almost daily now, so it is still a deadly virus that we have to be concerned about. If you are in Pine Hills, Rosemont, or the Lockhart areas of the county, the state of Florida has hired canvassers to come to your door and ask if you want to be vaccinated in your home. Of course, we're looking at certain demographics for that. The canvassers will be paired with Orange County firefighter paramedics who will return to administer the shots once you are registered. We are proud to be part of this partnership with the state aimed at helping homebound seniors. Yesterday, on St. Patrick's Day, our business compliance strike teams visited 39 downtown Orlando businesses. I'm proud to report that only one location was found to be out of compliance for not abiding by the county's facial covering executive order, and that was Cleo's Lounge. The other 38 establishments were doing everything right. St. Patrick's is traditionally a busy time for bars and restaurants with large crowds. Our strike teams were happy to meet with bar and restaurant owners who were more than prepared and actively protecting their patrons and employees. Again, that's what we want to see. They had hand sanitizer and masks available. Staff were wearing masks, and some businesses even hired extra security to ensure patrons, too, were abiding by these safety protocols. Overall, our compliance strike teams have made nearly 10,000 inspections since July and continue to see a very high rate of compliance, 99% across the county. And now I'm going to turn it over to Ms. Alvina K from the Florida Department of Health in Orange County, who will help fill in the blanks with the data.
Thank you, Mary Demings. Thank you. As the mayor had mentioned previously, Orange County has had a total of 119,224 positive cases since the beginning of this pandemic. Our recovery rate is currently 97%, and our 14-day rolling percent positivity rate is 5.2%. Unfortunately, since the last time we spoke, we've had 11 additional COVID-19 related deaths reported to us, and we offer our heartfelt sympathies to the families and friends for their loss. 5 of these deaths were in females, 6 in males, 6 were Hispanic, and 5 were non-Hispanic. 7 had known underlying health conditions. 4 had no known underlying health conditions. 8 dates of death are from February, and 3 dates of death are from March. 3 of the 11, or 27%, were reported from a long-term care facility or nursing home address. Since we last spoke, we've had 2 additional B.1.1.7 variant cases identified in Orange County residents, and that brings our current total of COVID variant cases to 19. Both of the cases had an unknown travel history. The age group for one case was 25 to 34, and the age group for the other was 55 to 64. And as the mayor mentioned, we will open our vaccine appointment portal this afternoon for next week's appointments, scheduled at the Orange County Convention Center, and you can visit our CDR Health Pro website at www.patientportalfl.com. And a reminder from a public health standpoint, the best vaccine that you can get is the vaccine that is available to you right now. As of March 17th, we've had a total of 359,332 doses administered. Doses administered to people 60 plus, 238,589. Doses administered to Orange County residents 60 plus, 200,725. And so residents receiving 1 or more doses of vaccine is 15%, as the mayor mentioned, and that's 168,000 residents. And residents 60 plus receiving 1 or more doses, 129,001, which is 57%. And so as we head into spring break or in spring break in certain parts of Florida, I just want to remind from a public health standpoint that everyone, we're so very close, we hope, to getting a good handle on this pandemic. And with the increase in vaccinations and the capacity at the Orange County Convention Center, opening up to more persons, we can increase the community immunity. We're still in this race to get that immunity built up to get a handle on the pandemic. And so, to remind everyone to avoid large gatherings, please, and still continue to practice the good pandemic precautions until we can move to get everyone vaccinated who's eligible. So the pandemic precautions to please wear your mask and wash your distance and wash your hands, and to avoid large gatherings, and especially stay at home if you're sick. And I'll turn it back to Mayor Demings, and I'd be happy to answer any questions later. Thank you.
All right, thank you, Ms. Shu. At this time, we'll open it up for questions. We do have Orange County Commissioner Maribel Gomez-Cordero, who has joined us. Ms. Ilia Torres is here. If there are any questions for our Spanish-speaking audience in Spanish, she can do the translation for that. Once again, if there are questions regarding the mental health program that I talked about, Ms. Donna Weiss is here to answer questions for that. And Tim Bolduc is here also regarding compliance team efforts. And so with that, we'll open it up for any questions at this time.
Eric Mock, Spectrum News 13. You just announced that starting Monday you're going to lower it, to age 40 and up. Did you have to get special permission to do that, or do you not have to do that? And last week, Dr. Pino had said, maybe we shouldn't open it so fast because everyone's going to flock here because they can't get it other places. Is there a reason why you went ahead and made that decision anyways to do that?
Well, I obviously have consulted with Dr. Pino. Given the known inventory or supply of vaccine that we have, we are reasonably confident that we can open it up to the eligible group that I mentioned, those 40 and above. Why did we do that? In terms of the surrounding counties, earlier today I had a conference call with Lake County, Osceola, Seminole County, who joined us. I believe that what the other counties are experiencing with a high level of those who are 60 plus or 50 plus having already been received vaccines within their respective counties at 50% or better of their population. I don't believe that with us making the adjustment to go to 40 is going to be problematic for us, number one. Number two, we have additional capacity at our existing locations that each day we have available supply that is not getting in the arms of individuals. So our goal and the goal of the president is to increase the number of individuals who are actually receiving shots in their arms. I was on a conference call earlier today with White House staff and intergovernmental affairs, and they made it known that by executive order, the president is now saying that by May the 1st, the directive to all states is to ensure that each state by May 1st makes available to all adults, the opportunity to be vaccinated. So that's not far off from now, as we are now in the middle of March, a couple of weeks of March left, and then May. So 6 weeks from now, we have got to get to the point where all adults will be made available or will be have access to the vaccine at that point. So we're getting to that point, and I believe that, again, with the 57% or so of the 60-plus population already having been inoculated, we can do it. So we want to make our decisions in a timely manner based upon what is happening on the ground here in this community. Now, part of your question was, do I need to get permission to do that? I told you before, I don't feel like I have to get permission to be the mayor of Orange County from Tallahassee. We're going to make decisions in the best interest of our community here using our resources, but we do so in partnership with the state. And so we certainly, my staff had conversations with state officials about it, and we believe this is the right thing for us at this time. Okay.
Lauren Seabrook, Channel 9. Mayor, this is for you and possibly Alvina, I think, as well. In your conversation with the other counties, did any of them seem like they may also go to 40? And I'm curious if, is there room to do more than 3,000 people now, since there is going to be probably a pretty huge demand with this?
Well, we won't know till we get there, and the other counties will make decisions for their respective counties.
I defer to Mayor Demings.
What was that?
I defer to Mayor Demings. I don't have any different information. Yeah.
But you don't know if you can go over 3,000 a day?
It depends on what happens with this new rollout. We'll adjust as it goes.
So the inventory, we on the call with the IGA within the last 20 minutes, they were indicating that once again for the upcoming week, the supply will increase across the nation. With them bringing on Johnson & Johnson, as well as the other pharmaceutical companies have increased their manufacturing of the vaccine. So that's good news for us. So that means that we're going to capitalize on that additional inventory, and we have to make our decisions in a timely manner to notify our residents and prepare for that. So it is likely that the numbers could increase, but we're prepared for that if it does occur.
Troy Campbell with Channel 6. Question for Mayor Demings. Yesterday, Governor DeSantis seemed to double down on if someone's getting a vaccine in the state of Florida that is not on his approved list, it's because they're at a FEMA site only. We saw with his clemencies for your fines for the strike teams. Is there a concern? You seem like you're saying you believe you have the authority. Is it your understanding that he could have the power to come in and reiterate his original list?
I don't know the answer to that question. You know, it's a hypothetical. We made a decision. We notified them. We communicated with them. I believe at the end of the day, the governor wants the best thing for the residents of Florida and Orange County, and that is to get as many people vaccinated as quickly as we can, given the supply, and that's what we're going to do. All right.
This is Kelsey Thorne with West 2 News. My question is also for Mayor Demings. Just kind of going off that, the governor said during a press conference yesterday that he had heard of a county that was pretty much offering the vaccine to anyone, and the state, he had directed the state to look into it. And now that seems to be what we're kind of doing here. So if you could react to that, and then also just really quickly in addition to that, is for the longest time when this Orange County site first opened, we were hearing that it was being run by the state. It was all the rules were coming from the state level and there wasn't much you could do about it. So what has changed now that you've decided to kind of take control into your hands, into the local level?
I think that's a fair question. The convention center site, for all practical purposes, has now transitioned and being run by the county. And not really being run by the state. It's our resources that's on the ground out there, although we do work very closely with the Department of Health. But our paramedics, you know, they're on the ground doing what they need to do to get shots in the arms of individuals. So we didn't open it up to everyone. If that was a question that you asked, and that was the question for the governor yesterday. We looked at our population, our current rate of vaccinations, and we made an adjustment to fill the gap with the current demand and the capacity that we have. So it's, you know, it was a calculated decision that was made in that regard.
Question in Spanish for Telemundo. My name is Edgar Carrillo. Hemos visto muchas personas, sobre todo jóvenes, que se acercan a los distintos puntos de vacunación en toda la ciudad. Vienen en farmacias, CVS, Walmart, Publix, incluso los sites de FEMA. Algunos de ellos, lo conozco personalmente, han podido vacunarse en vista de una aparente policy de zero waste of vaccines. ¿Tiene conocimiento sobre esto? ¿Cuál es su opinión? ¿Qué les diría? ¿Quiénes están haciendo esto? Y su opinión al respecto.
We have seen younger people getting closer to the federal sites, vaccination sites, such as the FEMA-operated ones, Publix, and other pharmacies. And apparently they have been able to get the vaccine. So the question is, do you have knowledge about it? What is your opinion? And this is apparently in response to a zero-waste policy.
There's a zero-waste policy at any of these sites. I am aware that there are individuals who were not previously 65 plus or in those eligible categories of law enforcement, educators K through 12, or firefighter personnel who went to FEMA sites. And, well, it was a long question. I might as well give a long answer, right? Anyway.
Ciertamente hay una política de no desperdiciar vacunas. El alcalde está al tanto de que ciertas personas que no cumplen aún con los criterios de edad o con las diferentes categorías se han acercado a los centros de vacunación federal.
Okay, so the short answer is yes. There are individuals who have gone to the FEMA sites who perhaps were outside of the public eligibility criteria who receive vaccine.
La respuesta corta es sí. En efecto, hay individuos que se han acercado a los centros de vacunación federal y aunque estaban fuera de las categorías aceptables, han recibido la vacuna.
In addition, there likely have been individuals at the Orange County Convention Center site where individuals who did not meet the published criteria who likely received the vaccine as well to avoid the waste that you referenced.
En adición, otros individuos en situaciones similares también se acercaron al centro de convenciones y pudieron recibir vacunas con relación a la política de no desperdiciar vacunas que usted menciona.
I'm also aware of individuals who have been vaccinated through the VA hospital here who didn't meet I'm going to say the state guidelines because the federal government creates its own guidelines.
Además, estoy al tanto de otros individuos que recibieron la vacuna a través del Departamento de Asuntos de Veteranos, ello debido a que las agencias federales no tienen que seguir las pautas o directrices del Estado.
Again, at the end of the day, our goal is to vaccinate, get up to the herd immunity number of 79% or so of our population.
Al final del día, nuestra meta final es vacunar y llegar a la llamada inmunidad de rebaño en el 79%.
And perhaps Ms. Hsu can verify this, but what I heard Dr. Pino say earlier today was that if you took all of those 18 years of age or older who has received the vaccination in our county, a little over 20% of our county's population has been vaccinated.
Quizás la doctora o la señora Chu puede verificar esta información, pero en una llamada durante el día de hoy, más temprano en el día, el doctor Pino nos dijo que si tomamos todas las residentes de 18 años o más, estamos promediando un 20% de nuestros residentes ha recibido la vacuna.
So if we're at 20% of the adult population, getting to 79, roughly 80%, that means we have to do 4 times the rate of work to get to that point. I don't believe that we should go about the business of getting there slowly if we have supply, inventory of vaccine in our county.
Si estamos en el 20% de la población adulta y tenemos que llegar a un 79%, esos son 4 veces el trabajo para llegar a alcanzar esa inmunidad. El alcalde es de la opinión de que no tenemos por qué desacelerar el proceso si tenemos las unidades y el inventario para hacerlo.
Commissioner Gomez-Cordero, did Ms. Torres, did she translate perfectly? Okay, so we're good. I encourage people who are eligible to get vaccinated. There's no question about it. We are better off as a community getting vaccinated, especially as we endeavor to reopen schools and all of those things. It is going to be in the best interest of our children that our educators are vaccinated, that ultimately they get vaccinated, and really because what we're seeing with, I'm going to say, younger adults who want to gather in crowds, it's really important that we get these younger adults also vaccinated. We've done a fairly good job with our seniors, and now we have to kind of move to that middle ground, young adult, the 40-year-olds and above. And that's what we're doing here. Okay.
Hi, Mayor Demings, Lyra Greenberg, Fox 35. Excuse me if I missed this, but Do you know in Orange County how many additional people will now be eligible under that 40 to 60 group?
Yeah, we have the data for it. I just don't remember the numbers right off the top of my head, but the median age in Orange County is somewhere, I think, between 33 and 35. So that's the median age. Okay, we're moving there. She's coming to you.
We're still back here, Steve. Melissa Thomas with Florida National News. This question is for Ms. Chu, actually. How significant and important is it to actually, while encouraging people to take the vaccine, also encourage them to check with their physicians if they have a physician, especially in light of those who are still dying shortly after receiving their second shot?
So we do certainly encourage anybody who has any concerns about their health to consult with a healthcare provider before taking any kind of medication, which would include vaccines. There are some contraindications, and if you fall into those categories, they're on the CDC website. So one would be if you've had any previous severe anaphylactic reaction to any component of a vaccine previously, so then certainly consult with a healthcare provider. But we would encourage this. Vaccines have been shown to be safe and prevent severe hospitalizations and deaths, and that I think that benefit far outweighs risking not getting the vaccine and potentially dying from COVID-19. Thank you.
Steve Hudak from the Orlando Sentinel, and I was very eager to ask some questions. This is for both the mayor and Alvina Chu. Can you help us understand this? The convention center is able to do how many vaccinations per day? And will that be the only site in Orange County where people 40 and older can get that expanded eligibility? Or are there other places where they'd be able to get that under the decision you're making?
Well, there's a federal retail pharmacy program, and they will have to comply with the president's executive order, but it's possible there will be other individuals who can get vaccinated through those sites. Well, again, the VA hospital has been inoculating people who were not 65 plus. In terms of the county-sponsored sites, the convention center is the site where we're going to do that. The homebound program, we're going to be administering vaccines in the homes of individuals who are medically vulnerable. It is possible that some of them could be under 65 or under 40 as well, but they have to meet that medical criteria where they're homebound. Again, we're taking this effort into the neighborhoods as well. We want to ensure that we are addressing the health equity issues, and we are working with the state to focus on some underserved communities through the initiative that we will begin next week on Monday, where you will see the canvassers. At the press briefing on Monday, we will bring in some individuals so you can see what they look like, and you will see various communications pieces and that we will put up through social media and otherwise talking about that program. Again, we have this opportunity and this responsibility to drive up the demand and for individuals who want to get vaccinated in our community. We will not get 100% of our population who will say that I want to freely and voluntarily get vaccinated. But we're going to do our part to make certain that it is available if they desire to do so. We will be working next week with other trusted voices, elected officials, and others as we move into those areas that have been identified as having high social vulnerability index scores. We have identified the neighborhoods, zip codes, using census information, using data from the Department of Health about the demographics of who's been vaccinated and where there's underrepresentation. So we are being intentional about going into different neighborhoods. So we have a multi-pronged strategy to get the numbers up.
Do we have a number, though, the number of how many people do we think we can vaccinate at the convention?
Well, we it's set up for 3,000. However, we believe we can do more. Okay, and we believe that there's capacity there. And I just want to remind you that we still do have the federally sponsored sites and the pop-up sites associated with that, where individuals will be getting vaccinated as well within our county. So we have a lot of locations. Our community health centers are receiving direct allocations and supply from the federal supply chain, and they will be doing inoculation. So again, by May the 1st, the directive is all Americans have to, all adult Americans have to have access to the vaccine. And so, you know, it's a tiered approach. It's a layered approach that we're laying out, and I think our community will be right there.
Mayor Demings, Ms. Chu, I have a few questions for you this afternoon coming in. Ms. Chu, the first question is coming from Gabrielle Roussan, and she says, Disney World to the smaller attractions in Central Florida are seeking a rise in visitors during spring break this month. Because of the increase in demand, do you have any concerns about COVID spread in Central Florida? And with that, should the state prioritize frontline theme park workers to get priority and be put on the eligibility list to get vaccinated?
Right, so there's two parts to that. Primarily, do I have concerns about COVID spread in Central Florida? So in general, yes. Since we are in a pandemic, I do have concerns about COVID spread in Central Florida, which is why even for visitors, so for visitors and residents, we still urge the pandemic precautions while we try to build this immunity in our community as well as across the U.S. and in the world. So we would like visitors to as well practice, and all of the attractions and locations that we have in Orange County to continue to encourage and enforce pandemic precautions for any places that have any large gatherings. So the wearing of the mask, watching your distance, and washing your hands. And as we increase the eligibility, as the mayor had mentioned, I'm optimistic that there will be many more people who can get the vaccine and be eligible, and we will soon be able to offer it to whomever is eligible.
The next question I have is coming from Greg Fox with WESH, and it's to Ms. Chu. Orange County has vaccinated roughly 16% of its population through March 16th, according to the Department of Health report. Has the county requested more doses than it has received, and what is your reaction to that?
The vaccine operations, since our Orange County Convention Center pod site is primarily county run, I think I'd have to ask Mayor Demings for insight into that.
Mayor Demings, would you like to respond to that question?
I think I already responded to that question, but we are going to try to get as much vaccine as we possibly can. And we have to be prepared to utilize that vaccine and not waste any of it. And that's why we're doing what we're doing at this point, increasing the eligible pool. We are open for business. You know, by gubernatorial directive, Florida's open for business. So we have many people, thousands who are coming here into our county on a daily basis. You know, keep in mind we have been the #1 tourist destination for all of North America, one of the top in the world. And I believe we still, based upon air passenger travel, we've been the #1 airport by TSA counts for the last many days. So I know people are coming in here. So with other people coming in from various other places, that I think, I'm not an epidemiologist, but I believe it's reasonable to assume that the more people come in from various places, the greater the potential it is to increase our infection rate within our county. So how do we protect our county? The best way for us to protect our county is to increase the total number of people who are residents of our county who are vaccinated against the various viruses and the variants. Now, Dr. Pina also, I heard him share earlier today that a couple of additional variants have been identified here within our county. Again, it emphasizes the importance of ensuring that our county increases significantly its rate of vaccinations. And so how can we do that? Lowering the eligible group, expanding the eligible group by increasing, requesting an increase inventory and having a plan to be able to administer that. So fortunately, we have a great team here within Orange County, a great team of logistical people, our firefighters, they do a wonderful job. We have tried to anticipate what the demand potentially will be and prepare for that. So we're ready to go. We're doing what we have to do to be able to expand and not hurt ourselves in the process. So we're really, Steve, trying to protect our county by doing this and getting those numbers up quickly. The quicker we can increase that number, I think, the better we will be as we enter into the summer months where the travel here will likely increase. We do not want to lag. We do not want to be slow to react. We want to be proactive. And as a region, we want to be proactive because of this is where our workforce is. And as people come in, they travel throughout the region and perhaps throughout the state as well. So we're doing this with great anticipation that we'll be successful and not hurting ourselves in the process.
The last question is for you, Mayor Demings, coming from Ryan Lynch with the Orlando Business Journal. And he asks, do you expect other counties to follow a similar age range after the county's decision?
I don't know. I expect the other counties eventually are going to have to do the same. They're going to have to expand their eligible pool. So, and they will do that by lowering the age or expanding the criteria for who is eligible. Okay, looks like that's it. Donna Weiss, you got off easy today, so we still encourage people with this mental health program that we talked about, Orange Connects, to take a look at it and see if it's something that can be beneficial to you. This concludes the press briefing. Our next briefing is scheduled for Monday at 4:30. Again, we'll bring in some of the canvases and some other things that we'll do at that press briefing. We hope you all have a great weekend and be safe.